Good evening and welcome to Your Health Today with Dr. Soliman, My Media Prime Life. It is Saturday, 5 p.m. Today, as you know, I did not show for the live show last 2 weeks. And a lot of people asking, yes, I'm going to say what happened. I was extremely sick. And it was not any type of sick. Today we're gonna choose to talk about food poisoning, and I am the patient and the doctor. So we're gonna share my story, hoping that other people out there will learn from it. About a month ago, I was given some food. We're not going to go into the details who gave me the food, what's the intention, it doesn't really matter. So I was given some food to eat. I ate the food, all of it. The following day, by 8 o'clock in the evening, I had severe sensation of nausea. That was actually 3 Saturdays ago. I finished my show. 4 Saturdays ago. Exactly 4 Saturdays ago. I finished my show, and after I finished, and I had a very busy day at the clinic. So it was an exhausting day. By 8 o'clock, I went to take my bath before I go to bed, and I just couldn't come out of the bathroom. I almost went into coma. I didn't lose consciousness, but I just couldn't stand. I couldn't even breathe. It was as if oxygen just cut down. I couldn't breathe, I couldn't move, my eyes black, I couldn't see, everything was finished. As if it was my last moments on this earth. I prayed just to make it to bed. I don't want to die in the bathroom. I finally made it to bed after like half an hour of struggle. My nurses are all downstairs. I couldn't even get to the phone. I couldn't shout. I couldn't do anything. Was no power. That is the correct word. No power whatsoever. Not even a power to breathe. I just lie in bed and I don't know what happened next. I woke up by 5 o'clock in the morning, and the first thing I done, I went downstairs to the clinic and I done myself an ECG. Because I was thinking this could be a possible heart attack. The ECG came out normal. I used the help of my staff and I done myself an echocardio. The heart was absolutely fine. So it is not the heart. At this point, I cannot focus and read. I cannot read. I can see everything blur, but I cannot read. I cannot focus and read. Everything is blur. I continue the day. I worked. I never stopped working. I continue the day, but as no power. I'm working on maybe 10% capacity. That's it. 10 to 15% capacity. Barely move my muscles. I was confused. The cardiac is okay, so what is it? I had very strong suspicion this is just food poisoning, but which poison? If I do not know which poison, how can I know the antidote? How can I treat myself? The symptoms are all there. Loss of power. The muscles are as if they're paralyzed. And if they are paralyzed, including the respiratory muscles, no oxygen can come into the system. And if no oxygen come into the lungs because the respiration is weak, that means each single cell in your body is not breathing, because we need oxygen to the cells that is delivered in the blood, and the main source of oxygen, which is your lungs, are not contracting up and down in a well manner enough to deliver you enough oxygen to the cells. That's what I understand what was going on with me on a biomolecular basis. The next question would be, what happened? Which poison is that? That is the next question. A couple of days later, I go to a hospital nearby in our area in Southwest, and I run an eye examination. And the left eye pressure was 39, the right eye was 33. Assuming the machine is accurate, that means this is almost double the maximum normal value for an intraocular pressure. That pressure was very high. So I was immediately placed on some eye drops and some tablets to lower the intraocular pressure, the pressure inside the eye. But the vision is still not there. Especially the near vision is gone. And they couldn't explain to me what's happening. It's just the next day that I said, okay, let me just pray. Maybe God will guide me to what is the solution, what is going on. I consulted with other ophthalmologists as well, overseas friends of mine, but obviously they need to see me. So nobody had figured out what was going on. I know I have systemic manifestation, which is the extreme weakness, inability to walk, inability to talk. I talk in a very low tone. It's like, you know, no power. So when that day, I decided, let me just pray to God. God will guide me to what's going on. So just came to my head something called anticholinergic poisoning, because this is exactly what I'm suffering from. Muscles are too relaxed, as if they are paralyzed. No power, increased heart rate, sweating, dizziness, and I just figured, okay, this is it. Anticholinergic poisoning. In our system, we have two branches of the autonomic nervous system. Autonomic means it works on its own. You know, it's not like the somatic nervous system. When you contract a muscle, you control what you're doing. This one is autonomic. And it has two main branches. One is called parasympathetic branch, and the other one is called sympathetic nervous system. The parasympathetic nervous system, obviously, the chemical that is responsible for that nervous system is the acetylcholine. That is what makes your muscles contract. It is released between the nerves, called in the gap between the nerves, and then immediately get destroyed by something called acetylcholine esterase. It's an enzyme. So it stays only for fraction of a second, does its job, and then get degraded by acetylcholine esterase. What if now we have some kind of poison that block this receptor? Let me be clear. Let me explain. We have acetylcholine. That's the key to the lock. The lock in this case is the receptor. Each thing in your body has to have a receptor. Every cell in your body have to have a receptor for any chemical or drug out there. So acetylcholine have its own receptor that binds to it, and once it binds, the action is exerted, which is the muscle to contract. That is the normal function physiologically. In your muscles are the same thing, the same receptors for acetylcholine. Acetylcholine comes and binds, and then the muscle contracts. What if I have a poison that blocks this receptor? So that means acetylcholine is there, but the receptor is not available. And the receptor, if the receptor is not available, that means binding cannot take place. And if binding cannot take place, that means the subsequent effect will not take place, which is the muscle to contract. And that is exactly what I had. I had paralysis of the ciliary muscle. Ciliary muscle is just like the focus on a camera. You know, the regular camera, when you want to have a good picture, what do? You play with the focus, you adjust the focus so the picture is clear. That is exactly the same thing in the eye. The focus in the camera is the function of the ciliary muscle. And because of the poison, the ciliary muscle has been paralyzed and has been confirmed. When I went to the ophthalmologist, they put dilator drops in the eye. The eye is not dilating, it's refusing to dilate because the ciliary muscle is one here at this corner of the eye, and the other one is at the other corner of the eye here. Their function is to focus, meaning stretch the lens and release the lens. The process of stretching the lens and releasing the lens is called accommodation. It's called the focus. Once this muscle is paralyzed, the ciliary muscle here and here, then the lens can no longer be adjusted to accommodate for near vision especially, and everything will be blur. So that is exactly what the poison has done. Beside the systemic manifestation in the body, that is the effect on the eye. And if it didn't have the effect on the eye, I would never know. So it's the eye who gives it all away. So now I don't have accommodation in my eye. This right eye is much better than the left eye. And the poison, like I said, increases the intraocular pressure. And if you are not aware and you do immediate examination to measure the intraocular pressure, the eye can blow up. And I've seen cases like that. But I didn't, we did not know that basically it might be one of the reasons. There is other reasons for increased intraocular pressure. I'm talking about my individual case. How did the eye pressure, intraocular eye pressure increase? Is because of the ciliary muscle that also responsible for producing something called aqueous humors. That is, if the muscle is paralyzed and the production is not producing anymore, then we lose the accommodation and definitely we have increased intraocular pressure. So that is two things that the poison has accomplished by paralyzing the ciliary muscles. I lost accommodation, I have very much increase in the intraocular pressure, and that what gives it all away, because we now know we have an anticholinergic something that has been intoxicating my system. I have a friend in Canada who's a toxicologist. I shared the story with him and he confirmed it is definitely an anticholinergic poisoning. That is nevertheless mixed with diphtheria food poisoning. So whoever done the poison, the herb that they use is, according to the toxicologist, is called belladonna atropine. It's a herb. This is where atropine is coming from. So when they did that, they didn't do it in a sterilized matter, of course, because the intention is not really pure. The intention is not clear. The intention is not good. So I'm quite sure when they did this, they did a cocktail that is mixed. That least things we know is diphtheria that has been confirmed by the systemic manifestation and the eye manifestation as well, but especially the anticholinergic poisoning effect that has given it all away. Maybe the terms are a bit difficult to understand, but let me simplify it one more time so the picture is clear. So if you fall into the same symptoms, you know what to do next immediately. The nausea is there. Once you get poisoned, the nausea is there. The severe vomiting sensation that is there. Sometimes it's severe. So if you doubt at any given point you get poisoned, the first thing you want to do is empty the stomach. The first thing you want to do is empty the stomach. How am I going to empty the stomach? That's something we call gastric lavage. Gastric lavage meaning we're emptying and we're cleaning the stomach. You go to the nearest center, the nearest health center, the nearest hospital. You suspect that you have been poisoned. You tell them that I want to empty the stomach and do gastric lavage. They will do it for you. Immediately after, you take active charcoal, you swallow active charcoal, few tablets, it doesn't matter how many. We need to get rid of as much poison as we possibly can. If the poison has made it into the intestine, then we need to flush out. You take something that will flush out your intestine to get rid of it, because this is just like something there that is releasing, the toxins. See, like for example, I suspect it was diphtheria also mixed with the anticholinergic belladonna atropine. That is the name of the herb. Now, if we have belladonna atropine, we know we have the sympathetic overflow. And also, if we have the diphtheria is a bacteria. In itself is not really a big deal, is a bacillus. But the toxin it produces is the issue. It's a neurotoxin. Neurotoxin means it goes and affects the nerves. And that's exactly what it does. So now, if you suspect food poisoning, the first step within the first few hours, we need to empty the stomach. We need to figure out what poison is that, and then we take the antidote. And that is exactly what happened with me. We figure out what it is. I'm taking the antidote. Now today, I can climb up the stairs and I come to do my live show. Before I wouldn't be able to do that. So now, as long as you know what poison you're taking, what poison has been given to you, we're not going to take a poison. What poison has been given to you, obviously for bad reasons, for bad intention, then we'll be able to give the antidote and recover. I'm glad to be alive today, because maybe there is something left in my life to provide for people and help people. And I'm also glad that God has guided me what is the poison and what is the antidote. Fortunately enough, I have the antidote with me at the clinic. I didn't have to look far. So now, as I realize, let me add one more point. What makes me so sure that this is anticholinergic poisoning? When I bought some eye drops called pilocarpine, that is exactly like acetylcholine synthetic. I put one drop here, my vision is back and I can read. So I put acetylcholine. I overloaded the receptors with acetylcholine. Yes, I get my vision back. What is the price? I get a spasm in the muscles of the orbits, and it was paining. Because acetylcholine causes contraction. So I overflow. I cause too much overflow of acetylcholine. My vision is back. My accommodation is back. But that's just for me to know. It's a diagnostic thing. Now I'm still on medication to lower my intraocular pressure, the pressure inside the eye. But at least we know that I can now systemically talking, I have maybe 50% now power. My systems are all back in order, and everything, we thank Allah subhanahu wa ta'ala for that, everything seems to be improving to the better. The vision is improving, and it will take time, because one concept we have to understand together, the receptors for acetylcholine that make this ciliary muscle dilate or contract according to what accommodation you need. This muscle is a ciliary muscle that is innervated by parasympathetic, and the main chemical in this case is acetylcholine. And we said for the acetylcholine to work, it needs a receptor. If the receptor has been taken away by the poison or destroyed by the poison, because sometimes when the poison lock into the receptor, it is irreversible, meaning it stays there and it doesn't want to go. So what will be the ultimate solution then? We will just have to wait till this receptor is gone and your receptor is coming, and now you have no poison inside the system, and now you can accommodate very well. Now, the next question would be, how long does it take? How long does it take before a new receptor to be made? Well, about 6 to 12 weeks. The good thing is not all receptors are made in the same day, same hour, same second. And that is why not all of them will die off in the same day, same hour, same second. Some is made today, some is made yesterday, so they always been made and they always been dying off. So every day that your system is free of poison, new receptors are being made that will respond to your acetylcholine. That is why over that one last month, I gained about 50% of my power because new receptors are being made. And the old receptor that had the poison attached to them are dying off and the system is getting rid of them. Through the kidney, through the sweat, through whatever means, you excreting them, you're getting rid of them. Yes, what helped me also is that is very essential is something we're going to talk about after the break, something called antioxidants. Usually, once a week, I take an infusion of antioxidant into my body, and I think that's what has saved me. Otherwise, the target was death. And if my system wouldn't take the poison, I would have been dead. And what really have saved me, God before everything, is that antioxidant that I was taking. Let's take 1 minute break and I will share with you how the antioxidant work and how it helps you to recover in case of any poison or free radicals in your body. Let's take 1 minute break and we'll come right back.
When it comes to toxic elimination from the human body, the liver and kidney plays a vital role. Your health is your wealth and therefore needs to be kept in constant check. Dr. Soliman Clinic and Labs offers you the opportunity to find out about your liver and kidney today. With us, you will have a free liver scan and hepatitis B test by Nsah just at 5,000 francs CFA. Find out the state of your kidney. With us, we offer free kidney scan, and if your creatinine is above 1.5, we have the solution. In addition to that, we also offer free medical consultation and free body scan. We are located in 2 cities. In Boya, we are located at mile 18 Bomaka. In Vola, you can find us at Bonaberry, precisely at Entrepilot. You can also reach us through the telephone number 694-940172. Your health is at the right place with Dr. Soliman.
Yes, good evening and welcome back. So I was saying, antioxidant treatment and prevention of any bad thing that may happen into your body. The strongest and the best and number one antioxidant as far as the power and the efficacy, the master of all, is something called glutathione. Glutathione is a substance that is produced normally in your body. So we know if your body produces it, that means it is actually safe. And if your body produces it, that means there is no actual side effects, as long as the dose is adjusted and you know what you're doing. So why our body needs antioxidants? And that is, by the way, what has saved me from the poison. Because every week I take 1 full infusion, 600 milligrams of glutathione. Obviously with other vitamins like vitamin C, B complex and all that. So what does the antioxidant do? Or what is actually did in anybody case who have bad oxidative stress factors in their body is to do the antioxidation. Meaning what? Let's define what is free radicals, the things that cause harm to you. How are you going to manifest out there? You are tired all the times. You forget most of the times. You have pains. You wake up in the morning, you're not yourself anymore. This is one of the reasons that you are feeling like this, because of the oxidative stress, because of the free radicals. Free radical sources are 2. Number one, in the environment we live, we are subject to, we are exposed to a lot of oxidative stress factors. Food we eat, canned food, poison, preservatives, anything, even the chemical that they throw in the plantations and in the fruits and on the vegetables and you swallow, all those are things that can cause free radicals in your body. When I say free radicals, those are very unstable compounds that look for electrons to be stable, and they steal that electron from you once they enter your body. We know every cell has a a fat bilayer, like bilayer, lipid bilayer in the cell membrane, and sometimes one free electron is just hanging around. That free electron is a component of that cell. If you take it away, you destroy the cell. So what this free radical will do is come into your body and steal that electron to stabilize their own self, but cause damage to you. So if this cell happened to be in the brain, you will get a little bit of dementia, you forget things, you cannot focus, everything is, fuzzy. If it happened to be in anywhere in your system, in your body, that is also gonna cause very much the same thing. If it happened to a nerve, you will get the pinprick sensation. Your feet will be burning at the bottom. You feel like as if somebody's sticking you with pins. You will feel all those bad inflammation of the nerve signs and symptoms. So, and you have to remember, the most fragile thing in your body is nerves. Nerves are very fragile. So if we have free radicals in your system, definitely, the number one that will be affected is the nerve and the nervous system, because this is the most vulnerable, the most fragile component of your body. If the nerve get affected, you have all the manifestation. Doc, I feel pain on my neck. I cannot twitch. I cannot twist my neck. I feel as if like pins and breaking my feet. I feel like heat in the bottom of my feet. I feel like things are moving on my feet or on my legs. Those are all signs and symptoms of inflamed nerves. So again, to repeat, oxidative radicals, free radicals, affect you, and number one that is getting affected is your nerves. Nerves are very vulnerable, very fragile. They get affected by the oxidative stress, represented by the free radicals. So what is the solution? Number one solution, we need to know. We need to know. We need to know a few things. Are you diabetic? Why I'm saying that? Because sugar is number one enemy for the nerves. Do you have any other medical condition that may affect the nerves and the nervous system? If yes, yes. Are you hypertensive? Is your cardiovascular system is okay? Because extra pressure, and not enough food supply and oxygen supply to the nerves can also affect the nerve. Sugar definitely affect the nerves. When you have too much sugar in the blood, the red blood cells become coated with sugar. And when they become coated with sugar, they become sticky. They stick to each other. And when they stick to each other, they clog the capillaries that feeds to the nerve. And when they clog the capillaries that feed to the nerve, that nerve is not getting what it's supposed to get, and it dies off, and you get the inflammation as an initial process, which now you feel all the symptoms, the tiredness, the break sensation, things moving on my skin, the heat on the bottom of my feet. All those are symptoms of inflammation of the nerve. So now what is the solution? There are many solutions. Number one, sugar is your enemy. Avoid sugar. Whether you're diabetic or not, you want to have good nerves, avoid sugar. Canned food, things that are pre-prepared in cans for commercial use, avoid that. Gas, soda, Coca-Cola, 7-Up, Sprite, all those drinks, avoid them, especially energy drinks. Energy drinks are very high in fructose, and fructose is worse than glucose because fructose has nowhere to go except to the liver. The liver is the only one that can deal with that fructose, and it goes into storage into fat in your body. It does not give you no energy, it gives you high calorie, and it is bad. It is extremely bad. It provides dose of free radicals into your system. Avoid at all means those energy drinks. We know the situation now. We have a lot of free radicals. We need to get rid of them. And we said, number one you're going to do, and that's what actually saved me, is the antioxidant. Number one antioxidant is glutathione without any competitor. Glutathione is number one. We take a dose of that with vitamin C and vitamin B complex. If you maintain it, to me, prevention is much more better than treating if you get into anything. So make it a habit. Every 2 months of the year, check your system, detox your kidneys, detox your colon, go on antioxidant therapy, and for the next 10 months, you will not have a problem. So if I take care of myself for the 2 months in the year, the remaining 2 months I don't have a problem. Is this better, or getting sick every day and go from one place to another and everybody give you different diagnosis, different treatment, and you're going in circles from one place to the next? My advice to you is take care of your body. Prevention is much better than treatment. Get your system into an antioxidant as soon as possible. An antioxidant is not the only one that you're going to go into. In this session, we're gonna share with you other things that you can do to have a healthy body, a healthy mind, a healthy brain, and you can perform much better without getting sick all the times. So we've spoken about the antioxidant, we've spoken about the free radicals and how they destroy your body by stealing that electrons from those cells, damaging the cells. And now the only way is, if you damage a neuron or a nervous system cell, there is no regeneration there. You're done. So much better to protect yourself. Now, since we are talking about nerves, B12 is essential. And B12 we all have because we eat a lot of meat. It's available in meat. The B complex and the B6 is very essential. The omega-3 is very essential. Now we're going to talk about vitamin D and the nerves. If you have bad inflammation of the nerves, vitamin D is very essential. I highly recommend that you do a lab test for vitamin D, see how low it is, and then based on the numbers you get from the lab, we provide you with the injections of vitamin D. A lot of cases that have nerve inflammation and nerves problems, we measure the vitamin D, and believe it or not, all of them deficient in vitamin D. They are below the normal value, the low normal value. With small injection once a week for 5 weeks, the problem is corrected with vitamin D. But as you can see, vitamin D, vitamin E is also very important for the nerves. I will share with you next session with pictures. How can we naturally get vitamin D? How can we get vitamin E? How can we get the omega-3? Glutathione, unfortunately, you have to take it in an infusion. There are tablets that call glutathione, but research data has shown that they are not effective as much. You may get some benefit from them, but it is not the same as if you get glutathione into your vein. So we spoke about glutathione, that is number one. So it has to be a number two. Yes, there is a number two, something called alpha lipoic acid. You can get it in a supplement, or you can get it also in an infusion. The dosage I will discuss with you. Alpha lipoic acid is very essential for those who suffer nerves. And believe it or not, after we do the therapy, whether glutathione glutathione and alpha-lipoic acid, and all the vitamins that we have mentioned, the patient in 2 weeks as if nothing happened. Especially those with diabetes and distal neuropathy that have problem with the foot and with the nerves, with the hands, especially the feet and the legs. They always have a problem. This will recover. Ignoring such a thing will make the problem just be worse. And we will not at some point be able to reverse the problem. So, to recap what I have just said, oxidative stress, you don't even have to get the free radicals from the environment. We produce free radicals ourselves every time we get emotional. Some people are very sensitive to emotion. They get upset, and then next day morning they wake up, they are in a totally different state, almost in a heart attack. So we respond to stress differently. When I say stress is the generator of the free radicals. Stress gives you free radicals. So if you try to be stress-free in your life, you'll avoid the free radicals. So ourselves, we produce free radicals. That is why we need antioxidant all the times. That's why God made food that has the antidote for the free radicals. And I just have mentioned the vitamin D. All milk products, all yogurt contain. Omega-3, the fatty fish, especially mackerel, salmon, sardines, all this contain omega-3. It is better to take a supplement. Vitamin D, we cannot take vitamin D because you overdose yourself with vitamin D, we have problems. So you must measure vitamin D before you decide to take vitamin D. Vitamin B12, vitamin B6, or what we call the B complex, is very essential for the nerves. Now, knowing the number 1, glutathione, number 2, alpha-lipoic acid. This combination here that I have just mentioned, it does miracles for everybody out there who complain of nerve problems. Now, let's take 1 minute break, and when we come back, we'll talk about something else.
When it comes to toxic elimination from the human body, the liver and kidney plays a vital role. Your health is your wealth and therefore needs to be kept in constant check. Dr. Soliman Clinic and Labs offers you the opportunity to find out about your liver and kidney today. With us, you will have a free liver scan and hepatitis B test by Nsah just at 5,000 francs CFA. Find out the state of your kidney. With us, we offer free kidney scan, and if your creatinine is above 1.5, we have the solution. In addition to that, we also offer free medical consultation and free body scan. We are located in 2 cities. In Boya, we are located at mile 18 Bomaka. In Vola, you can find us at Bonaberry, precisely at Entrepilot. You can also reach us through the telephone number 694-940172. Your health is at the right place with Dr. Soliman.
Welcome back. So we talked about oxidative stress and free radicals, and how we deal with them. Now, at previous sessions, we said colon is the major problems of all toxins in your body. Colon detox is very essential for a healthy skin, for a good vision, for a good heart, and definitely for good kidney that does not make stones. So the relationship between the colon and the skin and the eye and the brain and the kidney is very well established. So that means what? That means if you take the time, even if you're feeling super, it will help you if you detox your colon. It will make you have more energy, more glowing skin, free stones, kidney. It is essential. It is recommended. It is highly recommended actually. Why? Because the colon is the major source of all toxins in your body. Now, how are we going to do that? Let me add one more point. Every time you take a course of antibiotics, you're killing the flora inside your intestine. I had a case last week. The complaint was, every time I eat, I see the food undigested in my stools. 2 hours later, or even sometimes less, I go to the bathroom and I see whatever I have eaten. What is the history of this patient? The history, the patient has gastric being placed on omeprazole for a very long time. And that's a typical case. When you are placed on omeprazole for reason or no reason, you are actually minimizing the hydrochloric acid in your stomach. And the stomach has to have a hydrochloric acid at pH almost 1.5. If we lose hydrochloric acid, we lose the pH, maybe now it's 3-4, which is not enough to digest. The first station to digest after the mouth is actually the stomach. The acid in the stomach is very essential to digest our food. If we lose that acid, we no longer digest in the food, and the rest of the enzymes in the intestines are worthless because they need the acid to digest first. As a result, we will see what we eat inside the stools an hour or two later, undigested, even particles. The solution is what? Correct the pH of the stomach. But how are you going to correct it? It's going to pain because I have gastric. No, we have means to correct the pH without affecting the gastric. There are some products that we have put together that will make you increase the pH of the stomach, whereby we do not have this undigested food going into our stools every time we eat. And that is work on the pH of the stomach, correct the pH of the stomach, everything else will be corrected. Otherwise, if I lose the pH of the stomach and whatever I eat goes in the stools, that means I have what is called malabsorption syndrome, which means what? I have cramps in my hands, my leg, my muscles. I lost all the iron. If I do a full blood count, I will see my MCV in the 60s. That means iron is not being absorbed. And that is exactly what we have done for this lady, what we have seen. I know the case, I've seen many cases like that before. So magnesium, which is essential, magnesium get into the composition of all the enzymes in your body, including insulin. We need magnesium to make insulin. So for those who are diabetics, the key here is magnesium. You're short in magnesium, you have a lot of problems, and it's very easy to get magnesium. So what are we talking about here? We are talking about essential minerals, including calcium, iron, magnesium, that were supposed to be absorbed. And they can no longer be absorbed because I have a malabsorption disorder due to the decreased pH in the stomach because of that omeprazole that I'm swallowing day and night thinking that I'm relieving the pain. But I'm causing a lot of other problems on the other hand. So the solution is the products that we have that will increase the pH and not affecting the gastric. After we correct that, flora has to be replenished, because if you're taking a strong course of antibiotics, we're killing the flora. So flora has to be replenished, and this product will also replenish the flora for you. So we need to detox the colon, we need to replenish the flora, we need to get the absorption back to where it's supposed to be, so you don't have the cramps in the hand and you don't have all those manifestations because of the minerals that you have lost in the stools that they were supposed to be absorbed into your system. So if they fail to be absorbed into your system and they made it to the stool, it's just been wasted, and you will suffer the manifestation of deficiency in magnesium, in potassium, in the iron, in the calcium, all those things that were supposed to be absorbed at the level of the duodenum or the first early parts of the intestine, because we have no acid. Good. So we've spoken about now detox the colon. We have to do stool examination to see if there is any protozoa, parasites, or anything that affect your absorption of those different minerals. And most of the time there is. And it's part of our life. So we have to clean up and move on. It's not like you're going to be immune forever. You get a parasite today, we clean it up. Maybe next year you'll get another one. It depends on the food you eat. So hygienic protocol and when you eat something is very essential. And who you eat from, who feeds you is very essential. After we know what parasite is there, we detox the colon fully. We remove everything that's in the colon that is bad. And this process has to be once a month at least. You flush everything out from your colon at least once a month. Then you take another product that will replenish the flora and help all this villi, the absorption site of the intestine, to come back and become healthy again and absorb all those amino acids, the different fatty acids, the different vitamins, the different minerals, all those that supposed to be absorbed from the intestine into the bloodstream now is being absorbed without any problem. This process is not like you turn a switch on. This process takes time, so you must follow the protocol. Detox, replenish the flora. First, see if there is any parasite. Detox, replenish the flora, and everything is okay. If you do this once a year, the remainder of the year is fine. If you do the antioxidant therapy once a year, you know, like it takes about 8 weeks. You take it every week or twice a week. It's not like, so the rest of the year you will live a nice, healthy, happy life. So those are small things. Those are small things that will save you a lot of trips to different doctors and different problems. Because problems, when they happen, they don't happen like this. They take time. First, they show you manifestations and signs and symptoms. Now you ignore and you ignore and you ignore, and then over something big that we cannot reverse. So at the early signs and symptoms of the things that I have spoken about, you should see your doctor. Whether me or anybody else, Cameroon is full of good doctors. Now, I hope you understood what I have just said, and I hope you follow what I have just said. Let's take another minute break, and we'll prepare the last few minutes, with another quick topic.
When it comes to toxic elimination from the human body, the liver and kidney plays a vital role. Your health is your wealth and therefore needs to be kept in constant check. Dr. Soliman Clinic and Labs offers you the opportunity to find out about your liver and kidney today. With us, you will have a free liver scan and hepatitis B test by Nsah just at 5,000 francs CFA. Find out the state of your kidney. With us, we offer free kidney scan, and if your creatinine is above 1.5, we have the solution. In addition to that, we also offer free medical consultation and free body scan. We are located in 2 cities. In Boya, we are located at mile 18 Bomaka. In Vola, you can find us at Bonaberry, precisely at Entrée Pilote. You can also reach us through the telephone number 694-940172. Your health is at the right place with Dr. Soliman.
My last 5 minutes in this 1 hour, I dedicated to diabetic patients. Myself, I'm a diabetic. You know, we can control diabetes very well with diet. It doesn't mean that you leave your medication alone. No, it doesn't mean that. Every time I see a diabetic patient, I tell them sugar is your enemy number 1. Most of diabetic patients you see like they have waist fat, too much waist, too much fat in the stomach. You see the waist is thick. And the question is, how did the waist get so thick like that? We have to understand the concept that every time you eat, you trigger insulin to come out from the pancreas to bring those sugar, those glucose coming from the food you eat inside the cells. And insulin does not only bring glucose, it brings also potassium. And we're going to discuss about potassium in a different session. So now, what triggers insulin to come out? You eating. What if I don't eat? Insulin doesn't come out. So every time you eat, insulin come out. It does what? It brings the glucose from the blood into the cells where it's supposed to be. It brings potassium from outside into the cells where it belongs. But this is good. What is the bad thing about insulin? It takes the excess sugar and store it as fat into your viscera. So it's a fattening hormone. Insulin makes you fat. Patients with diabetes type 2, they have insulin in their body, but their cells have a problem with the receptors. The receptors are not very sensitive to insulin. The insulin cannot manage to push the sugar into the cells because of the high resistance of this tissue to the insulin. The insulin, we said, is the key, and the cell is the lock, has a lock on the top of it, a door. So the sugar to enter, insulin has to open the lock so the sugar can enter. If insulin is there, the key is there, but the lock is defected, then the sugar cannot enter. So as a result, when insulin goes high, you will get fat around your waist. So what is the solution? Intermittent fasting. Meaning what? If you eat your last meal at 5, 6 o'clock, make that your last meal. No more snacks till about 8 o'clock in the morning. When you wake up, have your tea or whatever. So that is about maybe 13, 14 hours of no food. So that is 13, 14 hours of no insulin in your body. That is 13, 14 hours of no insulin trying to make your waist fat and store fat inside your belly. So intermittent fasting is a very good solution, very effective solution to lower your insulin and also lower the need for your sugar medication. I'm not saying to stop. I'm saying that you should measure your sugar on a regular basis and you will see it dropping every day. This is one solution. The second solution is food, is what you eat. Sugar is your enemy number one. Whether you are pre-exposed to cancer, whether you want to have a healthy life, whether you want to fight diabetes, do not touch sugar or anything that contains sugar. Now, carbohydrates, eliminate. So we're going to follow what is called low-carb diet. Low-carb diet or ketogenic diet. That's the diet that does not contain any type of carbohydrates, especially anything that's made out of white flour, bread, macaroni, fufu corn. A little bit of plantain is fine, not much. A little bit of yam is fine, not much. But at all cost, you avoid carbohydrates. So we're going to do what is called low carbohydrate diet or ketogenic diet and the intermittent fasting. That's the two things. Intermittent fasting and low carb ketogenic diet. Keep checking your sugar, keep taking your medication and drop, and watch how the sugar will be dropped. And watch after 3 months, some research studies have shown that after 3 to 4 months of following just what I just told you, you may not need sugar medication anymore. I'm doing it myself. And I am not on sugar medication all the times. I control my diet. And sometimes I get okay, I want to eat some carbohydrates. I do it, but you get the point. Thank you very much. Have a nice weekend. God bless you all. And I will see you next session, next Saturday, 5 p.m. Be there. We're going to discuss very important topic about nerves. Thank you very much and have a nice weekend.
Welcome to into a new world of TV broadcasting. My Media Prime. News, discovery, culture, sports, entertainment. A BT Media Group channel with slogan, The African Eye. My Media Prime is 80%